Hi classmates, it's Holden. Missed you guys. Today I'm going to be presenting on Potter syndrome. I'm not technologically advanced, so I decided a YouTube video would probably be the best way to share this presentation with you. So Potter syndrome actually goes by 3 different names. It's known as Potter syndrome, Potter sequence, and oligohydramnios sequence. It's often referred to as a sequence due to the fact that there is a large variation of different signs and symptoms that go along with Potter's syndrome or Potter's sequence. And the sequence of events leading to the development of the condition are all the same though. So the presentation of Potter's syndrome, the main thing here is that there's kidney agenesis. So renal agenesis, hypoplasia, or dysplasia. So either the kidneys, they don't exist, either there's bilateral kidney agenesis or there's unilateral kidney agenesis. They're either not there, they're underdeveloped, or they're misdeveloped or malformed. So since there's no kidneys, they don't produce amniotic fluid. The urine produced by a baby in utero is what generates all the amniotic fluid, or most of it. And in turn, without kidneys that function properly, oligohydramnios is experienced. So amniotic fluid is critical for fetal development, and there is not enough amniotic fluid. Also, a problem because of oligohydramnios is a malformed GI tract and esophageal tract. As you remember from Mary Beth Kreger's lectures, swallowing of fluid allows passage through the system, and without the swallowing of fluid, because there isn't enough fluid, we don't have a properly formed tract. Also, a big thing for our side is pulmonary hypoplasia. This occurs because there isn't any of the breathing in of the amniotic fluid, leading to underdeveloped lungs. So another thing that goes along with Potter's syndrome or Potter sequence is Vader syndrome. So Vader syndrome, it doesn't always occur with Potter's sequence, but it does happen a lot of the times, and a lot of the things that are in the Vader syndrome sequence also occur with Potter's syndrome. So a lot of the things are represented here. So we have vertebral and vascular anomalies. So sometimes you have sacral agenesis, so the bottom part of the vertebrae doesn't form, or other parts of the vertebrae don't form due to the compression of the child in utero because of the lack of amniotic fluid as a cushion. You also have vascular anomalies, so the heart doesn't form the way it's supposed to. There's also anal atresia. Since there isn't that circulation of amniotic fluid, the anal sphincter does not properly develop. There's also tracheoesophageal fistulas, one of our favorite things that we learned about, as well as esophageal fistulas. Renal anomalies, so this is the big part of this Vader syndrome that goes along with Potter syndrome. There's kidney problems. Kidney problems are the main thing here. An L is often added because limb abnormalities are also seen a frequent amount of the time. This would be due to constriction in utero, leading to arms and legs not being there or being malformed. So Vader syndrome is a non-random cluster of birth defects that may accompany Potter sequence, but don't have to. It just is a nice umbrella that is included that sometimes is there and sometimes isn't. So it might seem like the problem list for Potter syndrome is super duper long, because it is. So there's also a lot of eye problems that occur because of compression of the head of the neonate. Ophthalmic abnormalities occur, such as cataracts, malformation of the optic disc, and prolapse of the lenses. So lots of eye problems. Cardiovascular effects that also can be included, as I mentioned earlier on Vader. Ventricular septal defect, endocardial cushion defects, Falix tetralogy and a patent ductus arteriosus are all problems that can occur, but they don't have to occur. So the thing with Potter syndrome is there's a lot of things that could happen, and there's a lot of things that couldn't happen. But the main thing is there are kidney problems that occur that lead to a decreased amount of amniotic fluid, which, as we all know, is necessary and critical for fetal development. So, with no cushioning provided by amniotic fluid, these poor kiddos sometimes have abnormal brain and or spinal developments as well. I referenced that back in Vader, but I did not mention the issues with brain development. A lot of other things occur, such as facial abnormalities. So flattened faces with a parrot beak nose is one of the things. A recessed chin, so their chin is pushed way back. Their eyes are farther apart than normal. And a crease beneath the lower lip, as well as low-set ears that lack cartilage. So one of the things that is referred to when you see a Potter baby's face is Potter facies. I don't know why they call them that, but that's what they do. So upon birth, unfortunately, Potter syndrome or Potter sequence babies are incompatible with life. They don't make it more than a few minutes. A lot of this is due to severe respiratory distress due to pulmonary hypoplasia of the lungs. Sometimes if kidney hypoplasia does occur, so they're just not developed quite enough, life can be sustained, but these kiddos are chronic kidney diseasers. They have major problems with kidney disease. If they do make it, they do need extensive surgical intervention. That would be correction of cardiovascular defects, as well as surgical interventions to fix malformation of the ureter, the anus, ophthalmic issues. The frequency of Potter syndrome is quite large. It's pretty rare. The bilateral renal agenesis occurs in approximately 1 of 5,000 births, and unilateral renal agenesis occurs in approximately 1 in 1,000 births. This is a predominantly male problem, so it's a 5-to-2 male to female ratio, and a lot of this is blamed upon the obstructive uropathy, which is more often seen in males because males have a more extensive ureter tract. And that's it. If you have any questions, please respond below and I'll try to answer them to the best of my ability. Thanks for watching.